So our next situation is most unusual. Never had to do it before in my 34 years either. That we had a beautiful young doctor, Dr. Clíodhna Donnelly, to give our talk today, and very pertinent after Father Jim's talk on dying. Dr. Clíodhna she's a medical doctor, she did her PhD in the whole area of palliative care, and she worked in Milford Hospice for a number of years. And she was to give the talk today at 12:30. And didn't she have an accident at home? So I said it's one of the most important talks of the conference. So I said, how would you feel if we asked somebody else to deliver your talk? And she said, no, that's fine. It's a message that we prayed and we felt the Holy Spirit wanted it delivered. So I asked another good friend of mine to do just that. So please put your hands together for Caroline Simons.
Hello, everybody. Well, I'm not Dr. Clíodhna Donnelly, and I'll do my very best with her talk. So excuse me if I look like I'm reading. I am reading. So, care for the dying in Ireland and the threat of euthanasia. And the first thing she starts with are two verses from the Bible, one from Luke chapter 10 and the other from Matthew chapter 10. After this, the Lord Jesus appointed 72 others and sent them out ahead of him in pairs to all the towns and places he himself would be visiting. And he said to them, "The harvest is rich, but the laborers are few. So ask the Lord of the harvest to send laborers to do the harvesting." And in Matthew, he said, "Remember, I am sending you out like sheep among wolves. So be as cunning as serpents and as gentle as doves." And as we know in our commandments, God commands us in the 6th commandment, "Thou shalt not kill." Each one of us is called by God to fight the good fight. We are called to stand up for our God-given moral standards and beliefs. We are called to be God's messengers and witnesses of his moral truths. We need to be beacons of light to those who have lost sight of God. We must speak out with our God-given authority in order to defend the weak and the most vulnerable members of our society. We must protect life from the moment of conception to the moment of natural death. It is important for us to be aware that we must not only be armed with prayer and the sacraments of our Catholic faith in our defense of God's moral truths, but that we must continually educate ourselves and as a community of faith encourage, inform and support one another in order to confront the arguments put forward by those who oppose our views. For this reason, I, or Dr. Donnelly, am speaking on the topic of euthanasia and assisted suicide, and its threat to the historical, beautiful tradition that we currently have in caring for the dying in Ireland. I will present the common arguments brought forward by the pro-euthanasia lobby. In October 2021, Mr. Gino Kenny, then TD, sponsored a Dying with Dignity bill in the Dáil that proposed legalising assisted suicide in Ireland. This proposal passed its first stage by a vote of 81 in favour to 71 against. Over the following few months, a joint committee on assisted dying deliberated and decided that the bill was too broad without safeguards and open to challenges in the courts. So in October the 25th last, 2024, a new revised bill in favour of euthanasia with assisted dying was noted in the Dáil by a vote 76 in favour, 53 against. Noted. It's unusual, I think. That's me, not the doctor. This vote was not to legalise euthanasia and assisted suicide itself, but rather a noting of the contents of the bill, and we're now waiting for the next stage of legislation, which will most likely not involve a referendum. Given that the right to life was addressed to the unborn in our constitution, it's now gone. The doctor then refers to a survey which was carried out by the Royal College of Physicians of Ireland in 2021, and at that time it showed that 86% of physicians in Ireland were opposed to the bill on assisted suicide. The Palliative Medicine Consultants Association of Ireland have also shown their opposition to the legalising of assisted suicide and euthanasia. And I should just say, you know the difference there. Assisted suicide is giving the patient something which they take in order to bring their lives to an end. Euthanasia is actually the doctor taking the action, him or herself, which will end the patient's life. Continuing with Dr. Donnelly. However, as we now know, we have a biased and anti-Catholic media, so these facts were never reported on. And then she actually explains what I've just said, so I'll skip that little bit there. The use of the word physician. It is important to note that the promoters of euthanasia and assisted suicide worldwide use the word physician in the title. That is, physician-assisted suicide and physician-administered euthanasia. The use of the word physician aims to mislead the patient and the public. The word physician represents a voice of trust, authority, and compassion. The use of the word physician allows the act of euthanasia to seem more acceptable and agreeable as a doctor is involved. Euthanasia and assisted suicide are a worldwide movement. In the United States, it is legalized in 11 states out of 50. Other countries, as we know, include Austria, Belgium, Canada, Germany, Luxembourg, the Netherlands, New Zealand, Switzerland, all 6 states of Australia, and it's also been legalised in Catholic countries, such as Spain, Portugal, and France. England and Wales have legalised assisted suicide only recently. If euthanasia and assisted suicide are legalised in Ireland, it has been proposed that we will follow the Canadian model entitled MAID. It's rather nice, isn't it? MAID, it sounds good. It stands for Medical Assistance in Dying, which is one of the most liberal forms of euthanasia worldwide. The supporters of euthanasia always claim that it will be introduced only for extreme and rare situations. And as we all know, this is the slippery slope. All countries that have introduced euthanasia, based on a very restrictive model, have now become extremely liberal. As we know as lawyers, hard cases make bad law. In Belgium, it is now legal to euthanize patients with non-life-threatening illnesses, those with mental health issues, and those with autism. It also allows euthanasia for children. And since its introduction in Belgium, deaths by assisted suicide have risen by over 1,000% over a 7-year period. In Washington, in the US, assisted suicide laws were introduced in 1998. In 20 years, there has been a huge increase in the amount of people availing of this, people who feel they are a burden to their families. In Oregon, assisted suicide was introduced in 1997, and 2 years later only, there was a 50% increase in generalized suicide in healthy 35 to 64-year-olds. The state called it a suicide contagion. The legalization of both assisted suicide and euthanasia results in the normalization of generalized suicide in society and the glorification of personal autonomy, with the mantra, my body, my choice, similar to the abortion regimen we all know very well here in Ireland. It is ironic that events for suicide awareness and suicide prevention in Irish society are promoted. These include fundraising for Pieta House and the suicide prevention movement Darkness into Light. Yet we want to now legalise patients taking their own lives or doctors directly killing their patients. Currently in Ireland, our laws provide the necessary protection for the sake of social justice and safeguarding people who are most vulnerable, including those with physical and mental illness and those with special needs. The Irish government should provide life-enhancing financial resources to increase the accessibility and availability of palliative care services throughout Ireland. Rather, what the Irish government is proposing is to promote what is quite rightly called a culture of death. The Irish law for assisted suicide, if introduced, would be based on the Canadian model. A benign-sounding term, medical assistance in dying, cloaking a most sinister regime. The term dying with dignity is used also, another misnomer, sounding very innocuous and full of compassion. The word dignity resonates favourably with the patient and blinds them to the true meaning of the act. There is nothing dignified or compassionate in brutally and deliberately ending the life of a patient by their own hand or that of another. Those who lobby for assisted suicide and euthanasia as a form of relief from suffering for the dying are at times merely looking for relief from their own discomfort. and their own suffering, while watching the patient die a natural death. In Canada, the term medical assistance in dying was hijacked from the field of palliative care. Palliative care, which we currently practice to a very high standard in Ireland, provides holistic care and dignity to the dying patient and their families at all stages. A multidisciplinary team accompany the patient with love and compassion on their journey to their natural death. A palliative care doctor in Canada stated recently that when doctors challenge assisted suicide in the hospitals, they are met with hostility, especially by the Canadian media. The doctor also stated that an increasing number of nurses and doctors are leaving palliative care in Canada due to moral distress, as they will not provide the assisted suicide, which is contrary to their own conscience and moral beliefs. The main argument promoting this movement worldwide by governments and the media is that it is good for the economy. It may not be said out loud, I'd say as an aside. Euthanasia and assisted suicide result in fewer elderly, fewer infirm or ill patients, less long-term use of hospital beds, lower staff salaries, and less costly medication. In Canada, MAID, assisted suicide, is taught at undergraduate and postgraduate level, so nursing and medical students are taught about it before they qualify. Palliative care is not integrated into their educational system at all. The overall philosophy of euthanasia and assisted dying is that any kind of suffering is not to be tolerated, neither in the patient nor in the onlooker. MAID is responsible for over 5% of all deaths in Canada. That is, 1 in 20 deaths in Canada. Numbers have increased from 3,000 deaths in 2017 to 15,300, I believe, in 2023. If assisted suicide is legalised in the Republic of Ireland, it would lead to permanent, irreversible and a detrimental impact on the medical, moral and social ethical standards in medicine. The safe, ethical and compassionate practice of care of the dying in our history to the present day would come to an immediate and a stark end. Many of the arguments presented by the pro-euthanasia lobby are that it demonstrates compassion and dignity. On the contrary, research shows that there can be a 10% incidence of unrelenting vomiting for days after the fatal injection in euthanasia, and 5% of assisted suicide patients experience a prolonged death for days after taking the lethal injection. And my aside, you may have heard of the case in Switzerland, I believe at Dignitas, where the person didn't die and means had to be used afterwards to ensure that they were dead. These statistics show the barbarity and tremendous lack of dignity to the dying patient. Palliative care, on the other hand, in acute hospital settings and in most hospices around Ireland, provide the utmost dignity to the dying. Multidisciplinary teams accompany the dying patients and their families. The teams consist of specialist doctors, nurses, psychologists, music therapists, art therapists, occupational therapists, social workers and chaplains, among others. As a team, they carry the patient to a dignified natural death, surrounded by the love of family and friends. There is dignity shown by all in caring for the dying. This involves the daily washing, dressing, embracing of the patient, simple acts of holding their hand, speaking to them gently even though they may be unconscious. There is dignity and compassion shown by the constant vigil, with ritual and recitation of prayers. Death is neither hastened nor postponed. Palliative care holds life sacred until the moment of natural death. And I would have to say, my mother's best friend was in a hospice for a number of months last year, and I never saw anything like the care given in the hospice. It was extraordinary, even down to seeing volunteers. It was extraordinary, extraordinary. Even down to seeing ordinary lay people. An ordinary lay woman came in, there was a piano in the corridor, and she just came in every day and just played the piano. It was absolutely beautiful, it really was. And there were 2 young men who died around the same time, young men, and it was quite tragic. And to see the love and the care of all of their college friends, their families, and the nurses and doctors, it's just a different kind of medicine. And continuing with Dr. Cliodhna. As I have previously mentioned, another reason patients might be compelled to ask for suicide is that they feel they are a burden to their families and carers. In this situation, the palliative care team can counsel the dying patient and mediate between carers and families together to gently remove the patient's fears. Another thing we hear a lot about is pain, extreme and severe pain that patients die in if they're not given euthanasia. In present-day Ireland, palliative care doctors and nurses excel in ensuring that patients do not die in pain. Advancing medical science ensures that this just doesn't occur. The medication is titrated to the exact amount required to relieve the pain without causing loss of consciousness as far as possible, so that the dying patient can remain conscious as long as is possible and continue to be present to their loved family around them at the bedside. The doctor notes here that something we mightn't always appreciate: pain is multifactorial. Find the root cause. It can be due not just to a physical reason, but it can be mental, physical, emotional, and spiritual, including the very suffering of being in existence, existential suffering. If the pain is purely physical, then medication can manage it. If it's psychological, the patient might be showing that they're depressed or that they're very anxious, and an appropriate counsellor who's skilled in all of this can comfort the patient with different therapies, and friends and family can alleviate them as well. It's just a most joyful thing, and it reminds me when Father Blunt asked if we had a word for joy, and I heard some people in the audience saying this, we have áthas. Yeah, áthas is happiness. We have many words for joy because we're a joyful people, and it occurred to me, you remember the ancient oath of the ancient people in Ireland, the Fianna, Glindar ar grí, is neart ar neig, is bart the rare ar mriher. So Glindar is joy and gladness in our hearts, strength in our limbs, and true to our word. So we have joy, and we're a joyful people, and we want joy in medicine as people end life. Dr. Donnelly says she has witnessed that patients can be lifted out of their depression and they experience contentment and peace in the last few months of their lives. In her experience, patients can be agitated and in turmoil due to underlying unresolved issues. This distress could be due to unforgiveness towards a family member or a friend that they mightn't have spoken to in years, and the palliative care team speak with the patient, and they can often bring the estranged person to the bedside where the dying person reconciles with them and the agitation is relieved and they can die in peace. Existential suffering or soul pain is a complex source of distress for the dying patient. Very often this source of suffering manifests as uncontrollable physical pain, and no amount of analgesia will relieve it. This fact alone gives us the diagnosis that the patient is suffering on a spiritual level. This existential pain is also called psychosocial spiritual pain, and it's being widely researched at the moment, and there have been huge breakthroughs. The dying patient can experience fear of dying, fear of pain, fear of loss of control, and loss of freedom. They can also be feelings of loss of autonomy and loss of self-worth. The patient doesn't show typical symptoms of depression or anxiety, but might describe an intolerable emptiness and longing. Patients near death often say they feel trapped, and even if they have religious faith, they can experience this kind of suffering. Screening methods are currently being researched in order to diagnose and treat existential suffering. A demoralization scale for the diagnosis and treatment of this suffering is based on 20 years of research and is now being used in Australia. This scale measures the sense of helplessness, hopelessness, etc. And once this is diagnosed, the palliative care multidisciplinary team can fly into action. The extremely important relevance of this research is that this can now be diagnosed and treated. And if a doctor chooses not to diagnose and treat the existential suffering, the patient could ask for assisted suicide or euthanasia. You remember the case of the twins in Belgium who were depressed and asked for assisted suicide and were given it. Dr. Donnelly says if this occurs, the doctor has failed in his or her duty and abandoned the patient, bringing despair and hopelessness. Palliative care, however, offers relief of this existential suffering. The palliative care doctor never abandons the patient nor their families. They always bring hope to the dying and their families. And she gives a number of quotes then from the experience of Belgian doctors. Euthanasia is not the pinnacle of care and support of the patient. It actually ends their support and care. It does not complement palliative care, it ends it. It does not relieve the patient of suffering, it takes their lives. And just to add to that, what we should be doing is removing the suffering, not the sufferer. And I was conscious when asked to speak to Dr. Donnelly's prepared paper of a number of things. We're living in an age where today, if we follow the media and listen to the discourse in public, it seems that man has no origin, man has no innate nature, man has no ultimate destination, and can literally live however he wishes, to the extent perhaps that he doesn't damage somebody else. But the Christian view of human nature and the sanctity of human life from conception to natural death provides a consistent legal framework in which the life of human beings is protected against destruction at all stages. If the concept of mercy killing becomes legally acceptable, then the entire legal framework designed to protect human life becomes weakened, in the same way as a very wise professor, Vinci, said to me 30 plus years ago, if you take away the right to life and take away the protection from the unborn, then all life protection is weakened. And that's the truth. You might have heard of the famous anthropologist Margaret Mead. Margaret Mead wrote many years ago when she was talking about the significance of the Greeks developing the Hippocratic Oath, which doctors had to swear to before they were allowed to practice medicine. She said, for the first time in the history of humankind, there was a complete separation between killing and curing. In the primitive world, the doctor and the sorcerer tended to be the same person. He with the power to kill had the power to cure. He with the power to cure had the power to kill. But with the Greeks, the distinction was made clear. One profession was to be dedicated completely to life in all circumstances, whether it was the life of a slave, an emperor, an immigrant, or a defective child, and regardless of rank, age, or intellect. That was what a pre-Christian pagan people decided was the role of medicine in our communities, and it gave rise, with its expansion throughout the world, when Christianity came, to a very noble, trusted, honourable profession. The profession of medicine, I feel, has been very badly damaged in recent years on very many levels, and trust in doctors must be at an all-time low at this stage. And Dr. Donnelly has said at the end, after listening to all of this, it might seem quite copious. And as Father Blunt has said, we must not lose hope. We must not lose faith. We must maintain a hope and trust in God. Despite the possible fact that euthanasia and assisted suicide will be legalized in Ireland, we have to continue, all of us here, each and every individual, young and old alike, to fight the good fight. We must believe that Jesus and Our Lady, the saints and all of heaven are at our side, and that ultimately all will be well. In the meantime, we have to keep speaking the truth, and we must push all of our, this is me, not Dr. Donnelly, push our elected representatives to put as much in the way of resources as they can in palliative care. I have seen it firsthand. The staff and the medical health care workers there are extraordinary, and everybody deserves a dignified and a peaceful death. Thank you.
Caroline, fantastic. Well done. You did a great job. Super job. Caroline would make a great train driver. We started 5 minutes late and she came in on time. So fantastic, and well done, Caroline, and great delivering a paper, fantastic delivery and fantastic content. So not easy delivering somebody else's paper. I must say to Dr. Cliodhna, I hope you're looking in from Galway.